And welcome to everyone. This is Richard Dasher. I direct the U.S. Asia Technology Management Center at Stanford University. We're very happy to cooperate with the main producer of the Forum on Global Public Health with Silicon Valley Global Health. And for today's program, first I'm going to ask Ms. Martine Petermans to give a few comments on behalf of Silicon Valley Global Health. She's our CEO. And then she will introduce a special guest, Ambassador Gunther Sluwagen, who is the Consul General of Belgium in Los Angeles. So Martine, why don't I give the program to you to introduce Ambassador Sluwagen, and then we'll come back with our main speaker.
Sounds good. Thank you, Richard. So welcome, everybody. As Richard mentioned, my name is Martine Petermans, and tonight I'm wearing different hats. One hat is as the CEO of Silicon Valley Global Health, a program designed to raise awareness on issues, challenges, but also worthwhile efforts involving global public health. Another hat I'm wearing tonight is as Amici Lovaniensis Executive Director, an organization that loosely translates to the Friends of Leuven, Leuven being a major university city in Belgium. That's why we also invited Ambassador Gunther Sluwagen, Consul General in Los Angeles of Belgium, to join us for tonight and give some perspectives on the program that we're hosting tonight, direct relief efforts. Just as on a personal level, why I feel so passionate about today's conversation is that the challenges and the issues that are happening right now in Ukraine hit very close to home. When I see the news and I see the pictures of the families fleeing the country, holding nothing but their children and maybe a bag of something, I do not see faceless and nameless individuals. I see my grandparents running away during World War II and having a baby, my mother, on their arm, my grandfather being a prisoner of war sent to Lithuania, leaving my grandma all by herself, fending for herself, looking for safety, looking for shelter, with nothing than a bag of some milk powder in her hands to make sure that my mom was fed. So this is a very emotional time for a lot of people, and it is important to me to highlight the efforts that we can do and need to do. Regardless of a political opinion about what is happening right now, we do know that there are many, many victims, innocent victims. The impact on the public health system in Ukraine is enormous. That's why I'm so proud to support Dean Axelrod and Direct Relief with their efforts that they're currently doing tirelessly to support and help the people in Ukraine. Before we get to that, I would like to welcome Gunther Sluwagen, Ambassador, Consul General, and a very active supporter of the activities of Amici Lovaniensis and Silicon Valley Global Health. Welcome.
Thank you very special good evening to you, Richard and Dean. Thank all of you for being here tonight and for showing interest in what is going on and showing your motivation in order to hopefully avoid the situation, the humanitarian situation that is going on now in Ukraine and in Europe. And it's a humanitarian crisis, as Martin said, which we haven't seen in decades in Europe. I would say, unfortunately, no evidence on sight, so we don't need that attention and that support for what's going on. I would like to say a few words what the European Union is doing on humanitarian and medical assistance, and just to show that we are working on providing humanitarian assistance on different levels and on different platforms. You have the EU working as an organization, as an institution. You have the several member states of the European Union. And then we have our support as member states of the World Health Organization. Now, as for the EU, let me just give you a quick overview. Since the 1st of March, we have dedicated $500 million to humanitarian aid for Ukraine. And that is assistance to Ukraine, but also assistance to the bordering countries, Moldova, Romania, Poland, because they have the first influx of the refugees coming from Ukraine. Plus, they also provide a hub to check.
We seem to have lost your sound, Ambassador Sluvagen.
You still there?
Yes, you're back.
I'm back. Okay. So I was saying that this humanitarian aid is provided by European Union and its member states, but also by Norway and Turkey, who are not member of the EU, but working with our institutions. The provision of that humanitarian aid is can be anything. It's provision of food, water, healthcare, shelter, ambulances, ventilator, disinfectants, first aid kits, trauma care also, and also what we're trying to do is evacuation of patients out of Ukraine into our countries. So as you can see, it's a very wide area of support also inside of Ukraine. Problem is, and that everybody will recognize immediately, how to get it there. And that's why we're also working on humanitarian access and humanitarian corridors. Another layer of support is provided by each member state of the European Union, and that is within its own borders. Like, for example, my country, Belgium, we have now registered 20,000 Ukrainian refugees. So they're provided with medical assistance, medical screening, but also integration and job provision. We think there are about 2 million Ukrainians who have left the country. Most of them are still women and children, and they're residing in the neighboring countries of Ukraine, ready, if possible, to go further, or maybe having to stay around that area. One last point I would like to make, which is I find a very important one. There is an enormous generosity of our general public and individuals, and they're showing a solidarity which was unseen before, which was unexpectedly, but it is very valid, and it is really an enormous support for our politicians to make their policies and to continue providing support for Ukraine in all ways, be it political action or whatever. But it provides steadiness and hopefully also solutions. But the individual support for this crisis is very strong in Europe, and in a way, of course, we're very happy about it, and we hope that will continue, but we hope it doesn't need to last very long. Thank you, Richard. This is just the message that I want to give, so I'll be happy to listen to the practical experience of Dean and Director Lee. Thank you.
Thank you very much, Ambassador Sluvagen. And one of the good parts of the current situation is the cooperation that we're seeing among different countries as well as different organizations. And I think on behalf of everyone, I really want to thank you for the efforts of Belgium and all of the other countries in the European Union, as well as around the world. For our main presentation today, I'm delighted to be able to introduce Mr. Dean Axelrod, who has both Doctor of Law degrees and an MBA from the University of Arizona. On the law side, Dean has worked as a contract administrator for a large corporation, as an attorney, and also as the the managing director of the U.S. Bankruptcy Court in the District of Arizona. On the MBA side, he's been a financial advisor. He was a coach and consultant and also advisor to small businesses and startups in regard to marketing, management, and business development. And since 2016, he's been associated with the nonprofit organization Direct Relief. He has been working on partnerships and philanthropy, and now he is the director of partnerships and philanthropy. Direct Relief has been around a much longer time, since 1948. And what I'd like to do is ask Dean to start off by telling a little bit about how you got into this, and also tell us about Direct Relief.
Thank you, Richard. And thank you for the invitation to participate this evening. I'm very happy to be here, and I'm so pleased to see the level of interest among those who have joined us and are participating in tonight's conversation. My path to Direct Relief was kind of just a skip and a hop from moving to Santa Barbara. I came to open a branch office for the financial firm Edward Jones after my term at the bankruptcy court in Arizona had wound up during the Great Recession. When the recession was formally declared over, the way the judiciary works is your budget gets cut. It's based on a variety of factors, and the need for my position was greatly diminished, and so it was a good time to move on. And so my wife and I decided a move to Santa Barbara would be the right choice. So we did that, and after a few years of working at Edward Jones and feeling that there was something that was lacking, I started to look for something that I could sink my teeth into a little more. And I found Direct Relief, which is a remarkable organization. And I'll tell you the reason that I was attracted to Direct Relief was partially the mission, but I wasn't necessarily looking for a humanitarian organization to work for. But what really got my attention was learning how, as a nonprofit, it didn't let its status as a nonprofit get in the way of its pursuit of best practices. And as I learned about its methodologies and its core values and its focus on execution, as much as its concern about the people it exists to serve, I felt like it was going to be a good home. As an MBA, one of my biggest peeves was always seeing nonprofits that felt that because they were working on a noble cause and had a noble mission, that execution and business practices were sort of secondary, important, or even a dirty word. A nonprofit shouldn't function like a business. That's a terrible thought. Whereas I think that whether you're in business to make money or you're in business to provide charitable humanitarian relief, you should focus on your function and do it as best you possibly can. So that's what brought me to Direct Relief. A little bit about our organization. It is, as you mentioned, Richard, it was founded in 1948 in the aftermath of World War II by an Estonian businessman who had fled the Nazis during the war and settled in Santa Barbara, and brought that war immigrant businessman mentality to a desire to help as people back in Estonia were beginning to rebuild their lives and gradually expanding to other countries and gradually expanding to serving more than internally displaced persons and refugees, but also seeing how the skills and capabilities the organization had could be equally valuable in situations where people are displaced by a natural disaster, which led to an understanding that the people most vulnerable in an emergency like that, everyone is vulnerable in a war. Everyone is vulnerable to a natural disaster, but the people who are most vulnerable are those who were vulnerable before those crises took place. People who are poor, people who don't speak the predominant language, people who, by virtue of where they were born or the color of their skin, are at a systemic disadvantage. So the organization's mission focused on providing healthcare support for the doctors and nurses and healthcare facilities, existing systems that serve those communities, and helping give them a boost from the ground up and bringing resources from above. When you think about the global companies that are producing the kinds of products that people need, and the people without the money to be paying customers are often left out of the mix. The market doesn't serve them well, and government programs often leave gaps, and government programs ebb and flow. And so there are always gaps for these populations that are vulnerable, and direct relief exists to try to fill those gaps as best we can. We work in over 100 countries a year, one of which is Ukraine, has been for about 7 years or so. All 50 states, the US territories, the sovereign tribal entities in North America. And that's kind of a snapshot. What you see behind me is the essence of what we do. We have Direct Relief has a special accreditation as a pharmaceutical prescription drug wholesaler. Though we don't function as a commercial wholesaler, we're regulated and accredited as if we were, held to the same standards, same import, export, same licensing requirements. And so we distribute prescription medicines, over-the-counter products, a whole range of healthcare resources, cold chain medications, vaccines, medical oxygen, the gamut, and financial support when we're in a position to do so.
Okay, thank you very much for those opening comments. I noticed that you said that really the gaps in government programs and also the vulnerability is something that kind of is always there, no matter whether there's a particular crisis situation or not. How does the situation change when you have a major crisis, whether a natural disaster or a war or whatever?
I'm glad you asked that, because I was going to have to weasel that in somehow during the course of this conversation. In an emergency, in Direct Relief's experience, what we see in a crisis is the same basic needs that existed before the crisis. When we're talking about vulnerable populations, they're chronically under-resourced with respect to care for chronic diseases, infectious diseases, basic care, access to doctors. And if they have access to doctors, they don't always have access to medicine. And so what we see in a crisis is really a matter of scale primarily. So the folks who needed help yesterday need more help today. There are going to be the additional factors that we can talk about related to mass migration and displacement. But from a public health standpoint, the population that is now at risk can be exponentially larger than it was the day before the earthquake, flood, war. So from a public health standpoint, you have a tremendous challenge with scale, and you have a system that is probably not experienced or equipped to deal with a level of trauma on a mass scale, and an increase in the need for resources that can be unpredictable and unpredicted, although there are situations where it can be somewhat predicted. So one of Direct Relief's signature programs is hurricane preparedness. Hurricanes are a very helpful natural disaster because you can see them coming and you can prepare for them and you can pre-position resources for them. An earthquake is harder to prepare for in a specific sense. You don't know where it's going to strike or when. We can geographically, regionally pre-position resources, and we work with intergovernmental regional organizations like the Association of Southeast Asian Nations, like the Pan American Health Organization, Caribbean Cooperation, Emergency Response associations, to provide regional resources, and we're gradually building out hubs for that purpose. But that's one of the big challenges. It's, the inability to predict. So you have this surge, this spike in need, and at a time when the supply channels are choked, they're broken. And so that, during normal times, you have the basic needs at a lower scale, you have open supply channels, and you have partners that are all working together to maintain the flow of resources. And so, so I would say the biggest difference in a crisis situation is typically, well, I'll add one other thing. So it's typically a surge in need, reduction in access, and when the need is greatest and the information is most needed, the information about who, what, where, when, what resources are needed, who are they going to get to, and so on, information is the least available. And so you have that challenge of having to figure out how to get good quality data and not be paralyzed by it, because by the time the information is really good, the need is diminished. And so you've missed your opportunity. In the situation in Ukraine, the big challenge right now that kind of distinguishes things is that in a normal disaster situation, you have everyone working together to open up supply chains, open up channels, repair infrastructure. But in this situation, you have the Russian military working hard to continue the spike, increase the surge in need. So rather than a diminishing surge over time, it's continuing. And there isn't universal cooperation to open up those supply chains. In fact, you have an active effort to diminish them further.
So we do have two situations there. We've got the situation still in Ukraine itself, and then we've got the situation with all the people who've been displaced and have moved to other countries, or at least to other parts of Ukraine. And one of the things that we had found in a lot of the programs we've been talking about with public health is the importance of establishing trust at a local level, especially with the local providers of services. And it's hard to do that in any kind of a supply chain. How do you handle that in a situation like this?
Well, I think the most important lesson that direct relief has learned over the decades is a lesson that its founder instilled. We still operate on the 2 or 3 core principles that Direct Relief's founder instilled in the organization in 1948. One of them is work with local partners who know the environment, who know what's needed, who know what the capacity is, and deliver what they request specifically rather than what you may think they need. So find out what they need, deliver on that in the manner in which they request it, involve them in the process. The second core principle is find partners from the business community, what I'll call the upstream side of this supply chain, who can work with you, who can donate product, who can provide expertise in logistics, and partner with them and build off of their relationships as well. So if you start with just those 2 core principles, you have the basis for long-term relationships, which is another of Direct Relief's core operating principles. We work, most of what we do is ongoing support throughout the year, delivering supplies to medical systems throughout the world. A small portion of what we do is emergency response, although it's what gathers attention and garners headlines and so on. But when the headlines fade away, direct relief continues because the process of responding and rebuilding can take years in most of the places where we work. And in most of the places where we work, during that time of rebuilding, something else is likely to happen that will be a setback. So the trust building has to begin. It has to be an ongoing process, and it has to begin ideally long before it's needed. So we don't expect to immediately build a trusting relationship in the middle of a crisis when the people we're trying to help have a lot of other things to think about than figuring out who we are, what we're all about, whether we can be trusted, and so on. And that's true whether we're talking about a health ministry in a particular country, or an on-the-ground NGO partner, or a health facility or association. So to build trust, we do a couple of things. One is we expect that the first time we reach out to a potential new partner in an emergency, that
let me interrupt you a minute, Dean. Somebody has gotten a phone call and has not muted yourself. So everybody please mute yourself if you're not actively asking a question or making a comment to Dean. Thanks very much.
Thanks, Richard. So the first time you reach out in an emergency, the response may very well be, thanks for getting in touch. We'll let you know. And so you need to, part of trust building is accepting that someone may not want your help right now. And just like in business, you know, the first time you reach out to a potential new customer, even if you believe deeply in your heart that your product or service is absolutely what this customer needs, they may say no. It may not be the right time. They may have another partner that they think is serving their needs just fine, or they just might need some time to do due diligence on you. In the middle of an emergency is not a great time to do it. So you have to be patient, and that willingness to listen, to take no for an answer, even if in your heart you hear no and you think, you know, maybe, or you think not yet. So that respectful approach, that listening, that asking before telling, those are the ways we build trust. And then, you know, after 70 years of doing this, fortunately, we're in a position now where we do have a global reputation. We have a lot of relationships, and one of the best ways you can earn trust of a new partner is through a recommendation from another partner.
She sounded all concerned, and it's like, I don't know.
You know, a referral in business goes a long way. So if we reach out to a potential new partner with an introduction from an existing partner, that goes a long way.
Thanks, Dean. That's a great comment.
And my niece was like,
It's interesting that you use the word customer to refer to this kind of person who's the ultimate recipient of what you're trying to provide. And I think that attitude is something for business that really does help the whole nonprofit arena, especially providing humanitarian assistance. People shouldn't be patients. They should be actively involved in getting what they need. I'm curious, you said that the organization has been in Ukraine for a number of years. So when this happened, can you say a little bit about how Direct Relief has responded and what your current situation is?
Sure. We've been asked by some of the partners we're working with to limit talking about things in highly specific terms. So if I keep things a little bit general, you'll understand why.
Sure.
You know, if I have my history correct, at around 2015, 2016, I believe, Ukraine had undertaken significant efforts to reform its healthcare system. And it was during that period that we first began working with an NGO in that country, kind of a mini direct relief in a lot of ways. Their mission was to find and acquire healthcare resources and distribute them to health facilities in Ukraine. And again, it's trust building on both sides. We began to work with them on a small scale. We saw that they were reliable and accountable and transparent. And so we began to supply the country with kind of just routine primary care and specialty care medicines, hypertension medicines, cancer medicines. We then, after a few years, I think, made our first contacts with representatives of the Ministry of Health directly. And that enabled us to work more strategically and help provide resources that at a governmental level were more strategic in terms of being able to work on the issues that they felt were the most pressing, which are sometimes different than a community-based or a grassroots type organization may see. The priorities may be a little bit different, both may be extremely important, but being able to earn the trust of governmental health officials, public health officials, as well as the local level NGOs and health facilities is also very important, because we need to be able to, if we're going to serve a country well, we need to be able to manage the process of importation, and we have to earn the trust that our products that we're delivering are high quality. So those relationships are really important. And until about the middle of last year, I would say that was kind of the primary work we were doing. About 6 months ago or so, we were asked to redirect our efforts to providing COVID-related resources. And that became a focus for the last 6 months or so, while at the same time continuing our routine, general chronic care support. And in fact, our last shipment before war broke out was really just a few days before the 24th of February. It was a routine shipment of cardiac medicine, cancer therapies, and within a couple of days of the invasion, in consultation with the Ministry of Health, we were asked to provide acute care resources. And one of the things that Direct Relief had developed during the pandemic was an ICU kit that was built in consultation with intensivists at hospitals across the United States, focused on what they anticipated and what our analysis was telling us were going to be the medicines and supplies that would be in short supply in ICUs. But many years before that, we had developed a field kit for primarily, initially, it was for the Emergency Medical Reserve Corps here in California. And I have a picture that I'll share, which will give you some insight into hopefully I'm sharing the right screen. I don't know if hopefully my.
I'm still seeing you, Dean. Maybe I should unspotlight you and that will help. Okay,
that?
There we go.
All right. So this is Direct Relief's Emergency Medical Response Backpack, which was designed for first responders in California to be out in the field, to do triage, to do advanced first aid. It's been adopted over the years in conflict situations and in almost every mass trauma context. And the Ministry of Health asked for as many of them as we had in inventory, which was several hundred. And we've been building out more, and we shipped them immediately. And we saw their pivot from primary care and specialty care medicines and resources to this acute care, obviously this acute care need. And that's been the focus. And now we're starting to shift a little bit but the primary need still remains this acute care. But we can talk a little bit more about how direct relief's response is evolving as the crisis goes on. But that's kind of the background to our relationship in Ukraine.
Well, that is kind of a direction that we should go, but not only how your response is changing, but people tend to have a short-term memory and not much after that. And I'm curious, when you have an emergency situation, a mass trauma kind of situation like this, what do you do to keep people supporting your efforts long enough to really take care of the long-term implications? Because there's going to be a lot of long-term needs as a result of this situation.
Yeah. There certainly will. And we're expecting this to, we're expecting our help to be needed for many years. That certainly was the case in Syria, and our efforts there continue. Any place there are refugees who are fleeing conflict, those challenges continue. Thinking about public support, direct relief relies entirely on public support. We don't request or receive any government grants. And we also don't really have a heavy-handed fundraising operation. Very light touch, other than corporations and foundations that ask us to ask them for money. We tend not to ask people for money. We have found that the response is deep in engagement when we're able to simply share what we do. We try to earn press coverage by doing what we do well and talking about it in a way that is meaningful and not exploitive. And people understand we're a charity, we're a nonprofit, that we depend on donations. And so, our attitude about treating the recipients of our aid with respect extends to treating donors with respect, whether they're pharmaceutical companies or individuals who are, writing a check or going onto the website to make a donation. And that respect is demonstrated by giving them good information, treating them like adults, and just knowing that if it's a good fit, they'll make the choice. By keeping people informed, our website, our news feed is very current, and it's deep. All of the programs that we're running globally are updated. And so we really just rely on the interest of people in these issues to stay invested. Now, from a kind of a nonprofit management perspective, we've seen over the years that by focusing on execution, by talking about our mission very broadly, and allowing others to talk about us as well, rating agencies, news outlets, supporters who raise money by, through gaming, online gaming tournaments, whoever they are, that keeps people interested in our broad mission. And many people are introduced to direct relief during an emergency and may donate for the first time because of this crisis. But if we do our job right, and if their interest in humanitarian support is broad, they will stay with us, and their donations, we honor restrictions, we honor donor intent 100%. So if a gift is made designated for the crisis in Ukraine, it will be used for that purpose exclusively and fully. So part of the answer actually to your question is that, we often will receive enough support in the early days and months of a crisis to carry forward at least for a little while. We can't use it all at once. We can't deliver to Ukraine the full amount of material aid and the full value of the financial support we receive all at once. Their capacity is limited. So that in itself helps extend the life of the support that we receive. But people will tend to start making undesignated gifts once they get to know the organization. And they trust that we're using it where it's needed most and where it can be put to best use. And that has served the organization well. We still have resources that we can put to work all over the world as more and more people. And I think that's really the goal of almost any nonprofit, is to earn the trust of their donors so that they will be comfortable making unrestricted gifts, knowing that the money will be spent wisely.
Dean, thank you very much. Those are absolutely wonderful comments. And what I'd like to do is to open the floor to questions. Anybody in the audience, if you have a question, please use the raise hand function on Zoom. That way I'll see that you've got a question. It will bounce your window up to the top so I can see you have a question. So for anyone, if you have any questions that you'd like to ask Dean. So Dean, how do you keep from running into other relief organizations? Or is it such a huge pie you don't have to worry about that?
That's an interesting analogy. I like that. Well, I think about, well, I guess there are a couple things. One is I think about humanitarian work kind of like a multi-lane highway. And for the most part, the sophisticated participants stay in their lanes pretty well. Direct Relief knows its lane, and we know our partners, and we know the other primary actors. We know for the most part who's doing what. The humanitarian response community is fairly sophisticated. I mean, the big players are. The World Health Organization operates what they call clusters, focused on different aspects of public health. Different UN agencies are great facilitators. These other international organizations, they're great coordinators. And by participating in these coordinated or coordinating organizations, the important thing is good information and information sharing. So we know who's doing what and who has what capabilities. We also know from our experience, Direct Relief knows that there are real hazards with well-meaning organizations racing into a situation and delivering material that hasn't been requested. Nobody knows what it is. Nobody's expecting it. It might be useful, but who knows? And nobody has time to look at it. And by this trust building experience over time, we can get a place in line that enables us to access the distribution channels without tripping over other participants. Right now in Ukraine, our relationship with the Ministry of Health and with our primary NGO partner in the country have been critical in successfully getting medicines into the country where they're needed. And as we speak, we've, the past couple of weeks, we've had staff in Europe holding meetings with the health ministry in Poland, with the health ministry in Romania, in I think Moldova's next on the list. And it's this idea that, we know there's need, it's growing. We've got to figure out who's doing what plans are in place, where isn't there a plan, and responding accordingly. So those relationships help keep us from tripping on other people, being able to move quickly and precisely, knowing where we're going. And that's a question of data and information gathering, which we can talk about. These are the factors that really make a difference.
So can I ask you a little bit about the kinds of partnerships? Your job is Director of Partnerships and Philanthropy. On the partnership side, are you mostly working with companies to help to get supplies that you will distribute? Or are you the part of the organization working with the government? Who are the partners you're working with?
To get a little in the weeds in terms of organizational structure, we have a team that's dedicated to relationships with medical companies.
Okay.
And that is not my group. My group is focused on support and partnerships with everybody else.
Okay.
And except for a government level relationships, and we have our program teams are probably the folks with the most direct contact at the government level. So yes, so these relationships with the medical industry, pharmaceutical industry, those also are ongoing, constantly building, lots of communication, good relationships, so that when there is a surge in demand, those companies know who to come to. They come to us right away. They answer our calls, and they respond to our requests for assistance.
Okay, understood. Ambassador Slovagen, your hand is raised. Floor is yours.
Thank you. Not so much a question, Richard, but just to commend the work of Dean and Director Relief, but also very much to commend and to point out the profile that Dean was dressing for us. You know, I spent 12 years in Africa and some years in the United Nations relief work. And I see how important these NGOs can be, what assistance they can give. But what is very important is the professionalism by the way it is done, and you have explained this. So what I just want to say is that humanitarian relief, it's not emotional, it's not sentimental, it's not individual guilt feeling or whatever. No, it's really a professional way of giving assistance, and it has to be like that. As Dean was saying, sometimes you get into conflict with different organizations, and you have to be very well prepared, and sometimes it's hard, and sometimes you have to step aside from your emotions in order to be professional. And Dean, congratulations with the work you're doing, and the work that other NGOs are doing, because it's very professional. Thank you.
Thank you very much for that kind comment. I think the same way. Dean, I'm going to turn it into a question for you, though.
Sure.
Out there are lots of organizations saying that they have ways to send help to Ukraine. Mm-hmm. How do you separate the ones that are professional from the ones that are maybe not so?
Mm-hmm. I think as a donor, and as a customer in a business, that really is the ultimate question. How do you know what's nothing more than a sales pitch, and how do you know it's genuine? And I think it's important to be an informed consumer, whether you're a consumer of charitable services. I keep bringing back business analogies because I think that's really the core of Direct Relief's approach. And there are things you can do to get a sense of whether or not the organization you want to support is going to serve you well. So first of all, what we offer, the biggest difference between what a charity does and what a for-profit business does is that for us, the customer is not the same as the payer.
Uh-huh.
And it's kind of like the insurance business, I guess, health insurance, right? Our doctors are serving us, but they're getting paid by someone else. And it's always tempting to cater more to the person who's paying than the person you're serving. That's a natural temptation. And the real professionals, the doctors we love the most, are the ones who treat us like we're the ones who are paying. And so as a donor, I think it's really important that you pay attention to how the organization treats you. Will it honor a restricted gift? Will it give you a chance? Direct Relief is bound to honor the intent of its donors, which means we have to give the donors a way to express their intent. So, one of the first things I look at is if an organization is saying, send money now, Ukraine is in crisis, I want to go to their website and I want to take a look and see if there's a way for me to make a gift that is restricted for the Ukraine crisis. And then I want to look and see if they have small print somewhere that says they reserve the right to use the money elsewhere. So, I think that as an educated consumer, we're pretty good at seeing an ad on television and saying, I'm pretty sure the pizza is not going to taste as good as they're making it look. But so I'm either going to ignore the ad or I'm willing to say, fine, I'm going to get the pizza anyway, but I know exactly what I'm getting into. And I think charitable donations work the same way. If you start remembering that a crisis can bring out the best in people, and unfortunately, it can also bring out some bad actors. And by maintaining a critical view and remembering that you want to be an informed consumer, you can look for these cues, and those are just a couple of good ones. Is their privacy policy easy to find and online, and is it easy to read and understand? So I think that, from a consumer standpoint, just some basic fundamental things. It does take some education on how to do it because we're not used to thinking that way. And I think our natural tendency is, our hearts are engaged and we want to follow them. So it can be hard to tap the brakes and say, hang on a minute.
Slow down and check things out.
I got a lot of calls this week. We got a lot of calls at Direct Relief, and quite a few of them, when I returned the call, people told me that they couldn't believe I returned the call. That's the experience people have with charities. If you can tell when it becomes about the money versus about the mission. So I think that's.
Thank you. I think that's extremely well said. Dean, can I ask you a quick personal question?
Sure.
So 6 or 7 years ago, when you decided to change your career to work in this sector as moving away from business and law, what kind of thought process did you go through, and what was attractive about Direct Relief to you?
Oh, that's an interesting question that takes a little bit of pondering. I think, well, there were a couple of things. So, it's a personal question. I'll give you a personal answer. When I started at Edward Jones, I think I was about 50 years old. I think it was just before my 50th birthday. I had built businesses before. I'd built a successful law practice. I thought, a lot of the people I knew who I had consulted before diving into that world told me they thought I'd enjoy it and they thought I'd be good at it, and they were right. Turns out they were right. But what nobody could really help me predict was what the lifestyle would be like and what the work would be like day to day, building that business and how long it would take. I built my law practice within the first year. I was making enough money and serving enough clients and doing interesting work. And 12 months, that's not bad. And so I thought, well, if it takes 12 months to build a financial services practice, that'll be great. But coming into a community that's highly competitive, like Santa Barbara, I knew nobody coming in. So I had to spend, first few months just getting to know the community. And it took about 3 years to see that the growth trend wasn't going to get me where I wanted to be soon enough. If I were 30 years old, it would have looked very different. But at 50, I thought, just when I start getting serious traction is going to be when I really want to start looking at, a more relaxed lifestyle, spending time with, my daughter before she goes off to college, and time with my wife. So those are really some important lifestyle questions. And then I also had to question, I've throughout my career, I've really been motivated by helping people. Although I wouldn't have characterized it that way at the time. I didn't feel like I was being driven by helping people, but I've always been in a support role. As a lawyer, I got the greatest satisfaction from working with clients who were just, their cases may not have been big enough for the big firms to take, and they were in a scary environment, and I could help them navigate it. And as a financial advisor, I was able to do that kind of work as well, help people who really needed it. But it wasn't really, the regulatory nature of financial services is fantastic for potentially protecting consumers, but it makes it hard for someone like me who's a little more entrepreneurial and wants to be able to do things a little bit outside the scope. I had those frustrations, and I'm a rule follower. So, I was constrained. So I was started to think about what's going to be a better lifestyle for my family, what's going to be a better fit in terms of doing more of the tasks, the functions that I love to do, and feel like I'm really making a difference in the world. And when I discovered Direct Relief, I saw that its approach to the work was wonderful. I did a Google search. I couldn't find any scandals. Their embrace of business principles appealed to me. I'm a little bit of a business nerd, and I really enjoyed that. And when I saw the impact we could make, and when I go out into the community and I talk to people, they are so appreciative when they learn about what we're doing. And our donors thank us for giving them an opportunity to help others in a way that they couldn't without us, without Direct Relief. When people give money to a charity, they're not typically giving money to the charity. They're giving money to the charity because they want to help some people they would help them directly if they could. If they could give them medicine or provide healthcare, that's what they would do, but they're not in a position to. And to be a part of something that is trusted and respected enough that people will turn to us, often in tears, wishing they could do more, knowing that we will take their money and convert it to the goods and services that will help improve people's lives. I can't imagine doing any work that gives me more satisfaction at the end of the day.
That's a fantastic note on which I'm afraid we have to close our program. You've given us so much to think about that are really best practices in trying to do this kind of good work. And I want to say, on behalf of the main producer, Silicon Valley Global Health, thank you very much to everyone to come. I'd strongly recommend you come back and listen to the recording. Watch the video on our website, siliconvalleyglobalhealth.org. Dean, Direct Relief is cooperating in this program. It's directrelief.org, right?
That's right.
And also, I want to recognize our cooperating organization, Arugya International Foundation, and the U.S. Asia Technology Management Center at Stanford. Dean, you've been very good to keep this informational and not let it turn into a fundraiser, because on behalf of Stanford, we're not supposed to do fundraisers. But thank you so much for the really good information. Thanks to everyone for your interest and for coming. Dean, this was fantastic. Please join me in thanking our speakers so much today. Ambassador Slovagen, thank you very much for your message. And I hope that we'll be able to have some positive impact to come back and see how some of the relief efforts have worked out before too long.
Well, thank you. I'm so pleased to be here. Very grateful. Thank you to everybody who has shown an interest in this effort. And I hope to see you all again soon.
Okay, thanks everybody. We'll call a close to the meeting at this point. Goodbye for now.
Bye now.